Ravaging coronavirus that is taking its toll on the world appears to be gaining grounds in Nigeria, with about 97 cases of the disease confirmed in the country as at the end of Saturday, the 28th day of March 2020. In Kaduna State, northwest Nigeria, the state governor Nasiru El-Rufai late on Saturday, the 28th of March, confirmed that his test returned positive of the coronavirus infection. He has since gone into self-isolation, leaving the deputy governor of the state to chair the state's task force on COVID-19, while urging residents of the state to stay safe.
Earlier this week, I submitted a sample for the COVID-19 test. The result came in this evening, and I regret to say that it is positive. According to the protocols for managing COVID-19, I'm in self-isolation as required by the case management guidelines issued by the Nigerian Center for Disease Control. That is for someone that is showing no symptoms. I wish to appeal to the people of Kaduna State to continue to closely observe the preventive measures already announced by our government. It is most important that everyone should do their utmost to stay safe, stay home, and stay alive. The Deputy Governor is in charge of our task force on COVID-19 and will continue to issue statements from time to time. Thank you very much.
The state government had earlier put in place measures to curtail the spread of COVID-19, with the Deputy Governor of the state, Dr. Hadiza Sabua Balarabe, in a state broadcast urging the people to obey the state government's directive on the stay-at-home order and observe basic hygiene.
I wish to thank our people for the growing compliance with the measures that have been announced to protect residents of the state from coronavirus. The number of persons in Nigeria that have tested positive for the COVID-19 keeps rising. This means we must all be more serious about preventive measures to ensure that we stay safe, stay alive, and save lives.
The Deputy Governor also stated that a state emergency meeting with top government officials have decided to ban the movement of Okada and tricycles in the state.
The operations of motorcycle taxis and tricycles are banned immediately, as they do not satisfy the conditions for social distancing. In any case, it is illegal under the law of the state to operate motorcycle taxis. The buses that are allowed to operate for now must comply with the new rule of not more than 2 passengers per room.
We recall that as part of efforts to contain the spread of coronavirus in the country, the Nigerian Railway Corporation had earlier issued a statement saying its services will be suspended nationwide starting from Monday, the 23rd day of March 2020. When our correspondent, Bosan Yakusa, visited the train station in Rigasa, Kaduna State, it was cancelled. Officials were on ground. Operations were on. No Aliyu and Lima health workers positioned at the train station to test the temperature of each passenger coming and going out of the train station.
Taking person temperature and find out that it's high. Just isolate for at least 5 minutes, then we can take it again. If the temperature has become normal, because sometimes because of the heat, temperature is still rise. Then if you take it again and there is no any high temperature, then we can bring the passenger to. And if the temperature doesn't reduce, then we isolate him and call the necessary authority concerned.
Passenger have to make sure they wear their hand gloves. They always use the hand sanitizers. Avoid hand with others. Avoid shaking other passengers. Avoid going overcrowded.
Even though the passengers seen at the train station were happy that the train shuttle services have not been suspended, they however called on officials of the train station to be proactive so as to control the spread of the COVID-19.
Yeah, I'm not satisfied because as I came into the train station, I really want to sanitize my hand and they don't have the hand sanitizer.
I will advise that maybe they provide a hand sanitizer so that as passengers are coming in, they can give, because not all passengers are opportunity to have the hand sanitizer.
So they have to be proactive on the health side. Then the hand sanitizer, and they even get one. I even asked maybe they should help us with, because people don't have so, there's not any precaution on that.
The Kaduna State chapter of the Christian Association of Nigeria, CAN, had reaffirmed its opposition to any event that will expose Christian faithfuls or family members to the chance of contacting the coronavirus, and called on its members to keep personal hygiene and maintain social distancing so as to help contain the spread of the pandemic. The president of the state's chapter of the association, Joseph Hyatt, called on the government to make judicious use of resources contributed for the purpose of containing the pandemic.
What we've been doing every day is to keep re-emphasizing this call that people must shut down places of worship. Let not because of greed you insist that people must come to a place of worship. Insisting that people must come and trying to spiritualize it and trying to see that whoever says there should be no church gathering as if he is against Christianity, I think that's an error. That must not even be heard from those of us who have really studied and are leaders of people. But I would have wished that the National Disease Control Office will commit herself more to finding cure, to finding prevention, to finding things that will help reduce future sicknesses that will come around us.
Tuberculosis remains a significant health issue in low-income and middle-income countries and is the leading cause of death as a single infectious disease, ranking above human immunodeficiency virus and acquired immune deficiency syndrome, HIV and AIDS. This was the center of discussion at the event to mark the 2020 World Tuberculosis Day held in Kaduna State on Tuesday, aimed at creating awareness on the need to understand the burden of tuberculosis and its similarities with the ravaging coronavirus pandemic. The Kaduna State Coordinator of the World Health Organization, Dr. Dauda Madugu, said both tuberculosis and coronavirus are being transmitted through the same way.
Just like coronavirus, TB is transmitted through respiratory droplets. We have been saying about coronavirus, how it is being transmitted through respiratory droplets. TB is transmitted through the same way when someone with the disease coughs, sneezes, or sings. And the major symptoms is usually cough for 2 weeks and above, with other symptoms like fever, night sweat, weight loss, difficulty in breathing, coughing with blood and so on. But the good thing is that TB is preventable, it is curable, the test and treatment are free across most of our health facilities in the state.
In a proactive measure to prevent and control the spread of the coronavirus, the management of Barao Diko Teaching Hospital, Kaduna, had temporarily suspended visitations to patients on admission in the hospital. The medical director at the hospital, Professor Abdulkadir Tabari, in a press briefing with journalists in the state, announced that only one relative at a time will be allowed to stay within the hospital premises in the case of need by the patient.
Whoever had a symptom to come in to this hospital and get tested, initial testing to confirm whether he or she has the disease. Whenever anybody is having the symptom, either you yourself that is listening or seeing me now, or your neighbor or somebody close to you, please don't hesitate to bring the patient to the nearby health facility.
Tabari further stated that any patient in the hospital suspected of having symptoms or signs of the COVID-19 disease will be immediately transferred to the State Infectious Disease Center for confirmation. The announcement of the state governor's infection remains the only case of the COVID-19 disease so far recorded in Kaduna State. Thanks for watching Television Nigerian, and always remember to adhere to all the directives given on how to stay safe during the coronavirus pandemic.